Welcome to Health Hour, a session for you by Black doctors, hosted by the Caribbean and African Health Network. Ever sat in a doctor's office thinking, they just don't get it? Or search for health advice online, but you can't understand it? Felt unheard? You're not alone, and you found your solution with Health Hour. Every Saturday at 11 a.m. This is your space where Caribbean and African healthcare professionals speak about health with a focus on Black people. We tackle the topics that keep you up at night: mental health, chronic conditions, preventive care, sexual health, men's health, women's health, heart disease, and much more. All with the cultural context that matters, because our Black doctors understand the unique challenges we face. Here is what you can expect: real talk from doctors who look like you and get it, lived experience testimonies, practical advice, illness prevention and management tips, and a space of understanding without judgment. You also get to ask questions. Your questions drive the conversation. Health Hour, where community meets Black health expertise.
Good morning. Can you hear me all? Okay, my name is Professor Ngozi Edi-Osagie, and I'm delighted this morning to welcome you to this Saturday's Health Hour. So if you're joining us live, welcome. And for those of you that are watching it on catch up, welcome to you as well. I'm particularly pleased today, as being a neonatologist, I'm welcoming a colleague who's also a neonatologist, Helen Gbinigie. Helen is an award-winning neonatologist with over 20 years experience in the NHS. She's based at Medway NHS Foundation Trust, where she supports neonatal services. And she was previously the neonatal clinical lead for Kent and Medway Element, the local maternity and neonatal systems at the ICB in Kent, providing that senior leadership from a neonatal perspective. But Helen's here today, and thank you, Helen, so much for coming, because she has had particular expertise with advocating for health equity, and she developed the Jaundice in Darker Skin Tone Babies Initiative, which included an e-learning program with the Royal College of Paediatrics and Child Health, but also 10 steps for how to recognize jaundice by health professionals and for you as parents. In 2025, she received national recognition awards from the BAME Health and Care Network, from BAPAM, and for Kent and Medway LMNS for her outstanding contributions to neonatal care. So now that I've embarrassed you enough, Helen, I'm going to hand over to you, but I'm really looking forward to this session because I think this is why we're here, to make a difference to outcomes to our Black community. So thank you.
Yeah, thank you so much, Professor Ngozi. I'm pleased to be here to talk about a condition that I'm quite passionate about. So I'm going to share my screen. Can you see my screen?
Yeah.
I can. Okay. Yeah, thank you. Okay, so good morning, everyone, and welcome to today's session. As Professor Ngozi has said, I'm a neonatal consultant from Medway Hospital, and that's just a picture of our hospital where I work. And we will be talking about newborn jaundice today, with a particular focus to Black and brown babies. So jaundice.
So sorry, the screen's gone a bit dark, so I can't see the slides anymore.
Okay, what's happened there?
So we did see the original slide of your hospital, and then
I'm going to try unshare and share again then.
Please, thank you.
Can you see the slides now?
Yeah, we can see the slide. I can see the slide. Thank you.
Okay, so today we will be talking about jaundice with a particular focus for darker skin tone babies or black and brown babies. And we want to help parents and families understand what jaundice is, why it happens, how to spot it, when to seek for help, particularly in your baby that jaundice might not be obvious to pick up with the physical, with the naked eyes. So the aim of the session is to empower you to seek help timely so that your baby can receive the care they need in a timely manner and prevent lifelong preventable complication. Jaundice can affect all babies. So black and brown babies are not more at risk of developing jaundice. The issue here is about detection because of that darker skin, the pigments, and how it masks jaundice. It can affect all babies from all ethnicity. And the yellowing that jaundice, that we see with jaundice, like I said, can be difficult to identify on black and brown babies. So by raising awareness, empowering you as families, because we understand that families and parents, they play a vital role. You know your baby more than anybody else. You pick up those subtle signs, those changes before anybody else. So the goal is to ensure you're empowered and you can advocate for your baby to receive care early, regardless of their skin tone. So what is jaundice? Jaundice is that yellowing that you see in your baby, either on your baby's skin or the whites of their eyes. And it can sometimes be noticed also in the tongue, areas in the body that are not as pigmented. And why does this happen? It happens because there is a buildup of a substance called bilirubin, which then deposits in the tissues and appears to the naked eye as the yellowing that we then see. So the key message for this slide is that jaundice is very common, and it is important to recognize it early so that you can get treatment for your baby or the support that you need as soon as possible. So in the womb, newborns usually, they get their nutrients from their mothers via the placenta. They have a cord that is connected to the placenta, and nutrient comes from the mom through the blood flowing in the placenta through the cord to the baby. In the same way, babies will send their waste to their mothers, who will then sort it out and it gets out of the system. But when a baby is born, number one, babies have more red blood cells than adults. And as part of their adaptation to the outside life, the life outside the womb, this red blood cell starts to break down. And that releases the bilirubin, the yellow substance that we have talked about earlier. Then number two, in the first few days of life, remember we talked about how babies get their nutrients and how they get rid of the waste. But now baby's body has to start adapting and learning to process this waste themselves, particularly the liver. It's the liver that does this job. So, but because the liver is just learning and maturing, it's unable to get rid of or process that bilirubin substance as quickly as they're being released. So this is what then causes the accumulation in the blood and becomes visible as jaundice. Most babies, despite this, they would learn and process the jaundice and will not need to have any treatment. But there are few babies that treatment might be required, and those are the ones that need to be monitored. But it is impossible to tell which babies will fall into that category. Hence, it is important that all babies with jaundice are monitored and checked for jaundice regularly, particularly in the first week of life. So this brings me to the slide on which babies are more likely to develop jaundice. But I would rephrase this by saying which babies are more likely to develop jaundice that will require treatment or serious jaundice. Again, I would reiterate the fact that jaundice is very common. It is benign in most cases. It would resolve with just frequent feeding and support from your healthcare professionals. But certain characteristics or factors might make a baby more likely to have serious jaundice if it's not picked up early. They may more likely need treatments. And these factors include babies that are born before 38 weeks of pregnancy, or if you've had a baby previously who developed jaundice and they went on to require phototherapy, it means your subsequent babies are more likely to require to be treated. Then if a baby is feeding poorly, I'm sure you might have heard people say babies that have been breastfed are more likely to have jaundice. It's not particularly the breast milk, but rather it's the issues that might develop around breastfeeding in the first few days of life, either baby still learning to latch or milk production has not really kicked in yet. So that might then result in baby being dry and might worsen the jaundice that they might already have, or babies who are losing weight significantly. That again could be accounted for by dehydration. If your baby develops bruising around the time of birth or swelling, sometimes due to the birth process, either using instrumental to help to guide baby out during delivery, they might develop a swelling on the head or sometimes bruising. And this swelling or bruising, obviously, there are blood cells under the skin, and this might break down in addition to the already known breakdown of blood cells while baby is adapting to outside to life outside the womb. So it makes them more prone to developing jaundice that would require treatment. Or if a mother has a different blood group, particularly mothers that have blood group O, and your baby has a different blood group, then your baby is more likely to require to develop jaundice. I beg your pardon. I just want to reiterate that babies who develop jaundice before they are 25 hours of age, those jaundice are most times serious and needs to be monitored quite closely. They are more likely to require treatment as well, or if there are any signs of infection in a baby. I want to mention a condition, an inherited condition that is particularly common to people of Black and brown origin, and this is G6PD deficiency. It is an inherited condition that affects red blood cells, making them more prone, it makes them more fragile in certain conditions, either exposure to certain foods or medication. So we do know from evidence that babies who have this condition might also be prone to having serious jaundice. But here, my key message is early recognition, good feeding, and timely help will keep your babies safe. Next, we're going to be looking at how to spot jaundice in your baby. How do you do this? What do you do? Again, we know that Black and brown babies, the yellowing on the skin might be subtle. It's possible it's there, but it might be unrecognized or even invisible to the naked eye. So, but there are particular areas on your baby's body that are less pigmented and might show this jaundice clearer than the rest of the skin. And those areas are particularly the white of the eye. So regardless of your ethnicity, whether you're Asian, you're African, you're Caucasian, the white of the eyes for all babies should be white. So that is a very good place to spot if a baby is developing jaundice. The mouth, the tongue, the lips are other areas, or the palms of the hands and the soles of the foot. By the time we see jaundice on the palms of the hands or soles of the foot of a baby, it's become quite serious. And such babies will require immediate medical attention. But thankfully, those are quite rare. I don't think I've ever seen more than one in my career. And this brings me to this guide that was created for parents with parents. This was co-produced with parents and with the intention to help parents and families and carers feel more confident about recognizing jaundice in their babies. And it is very simple to understand. Like I said, created with parents to make it fit for purpose and relatable. It tells you exactly how to check for jaundice, where to check for jaundice, and then what to do, how to seek help, who to contact. It also tells you when immediate medical attention is required. It supports you to know when further assessments is required, like baby requiring a TCB, because we already know that looking at a baby, even if we could see their jaundice, it's not possible to determine if a baby would need treatment or not. So it supports you to know when your baby needs further assessment, like a TCB check or a blood test to confirm the level of jaundice and the need for treatment. And these are just photos of babies of different skin tones with jaundice. You can see the yellowing of the eyes. You can see the different shades depending on the skin tone. This brings me to the slide that talks on when medical attention is required. Jaundice is common. It's important that we know this. It is very common. Also important to know that most babies will recover well, but there are certain signs that should not be ignored. When we see the signs, we need to act quickly. Your baby will need urgent medical attention if they become very difficult to wake up, because jaundice is known to make babies sleepy. So that might be the sign that you will see that your baby is excessively sleepy, they're difficult to wake up. At that time, it is important that you reach out for help. Or if the baby appears floppy, or they have this very shrill cry, very high-pitched cry that is unusual for your baby, or you begin to notice some unusual movement or breathing patterns, or any other signs that makes you feel that your baby is unwell, or even if it's just you feeling concerned, that is important because you know your baby more than anybody else. If you have any of these signs, reach out to your midwife or healthcare professional and have your baby checked. It is always better to have your baby checked and reassured than to wait and risk a delay in treatment. Why does timely check? Why does it matter? What is all the fuss about? Especially in a condition that we keep saying is benign. So most baby will recover from jaundice with feeding, like I said, but when it is untreated, especially in those babies that are more at risk, of developing serious jaundice, or for that matter, any baby without the risk factor could also develop jaundice that needs treatment. The challenge or the worry here is that if the level gets too high, it can then flow from the blood through the blood and go into the brain and cause some preventable but irreversible damage that will have lifelong consequences for your baby. This is the worry. This is what we are trying to prevent, especially in a condition that is benign. So that is why it is important that we do not take this lightly. It's not about scaring you, but it is essential that we seek help early to prevent the jaundice from becoming serious. The good news is that this complication is very rare, but it still does happen. And working together as a team, the healthcare professionals, the family around the baby would ensure that baby gets the right help at the right time. And that brings me to how jaundice is diagnosed. Number one, there's a suspicion or a concern. That is the first step. Baby would have an examination, a check that you also could do at home if you're concerned, and then reach out to your healthcare professional. So looking at certain parts of the body, like I said, jaundice starts on the face, the eyes, the tip of the nose. It then spreads to the chest and the body, the arms and the legs. So we can look at all these areas. Very important that you look at the baby using bright natural light, like putting your baby near the window. And then once you reach out to your healthcare professional, baby can be checked using a skin scanner like the one in the picture to check for the level of it gives an estimate of the level of jaundice and if they will require treatment or not. Depending on what that level is, a blood test might be indicated, which in most cases is done in the hospital. This then brings me to the jaundice chart. So this is how we are able to determine if a baby needs treatment or not. We can see this chart. The chart you use depends on the gestation of the baby. That means the time the baby was born, how many weeks of pregnancy your baby was born. So this is for a baby that was born at 35 weeks. The blue line here is the line that if the level, when we have a number, for instance, if a baby is born is day 1, this is 1 here, and we plot it on the graph, if it falls on this blue line or above it, it means baby needs to have treatment, the light treatment. If he falls on the red line, it means baby might need more intensive treatment. So this is how we can determine that a baby needs treatment or not. So how is it treated? Again, most babies will not need treatment for jaundice, or need treatment in hospital is a better way to put it. Out of every 20 babies that would develop jaundice, only 1 baby, 1 out of 20, most times will need treatment. And if the level becomes high after being plotted on the graph that I've just shown us and needs treatment, then baby is then put under phototherapy. Photo means light, that means light therapy. And this is what it looks like. Baby will be in the cot. For some hospitals, this is a care that can be provided at home. So far, there are no other worrying signs that requires your baby to be in hospital. But in some areas, baby will be admitted with on the postnatal ward or transitional care with the mother and will receive light therapy. This is the most common form of treatment that babies would require. And it uses a special light that would help baby break down the bilirubin, that is the jaundice. And then baby will then wee the jaundice out of the system or through passing poo. This is a safe, painless, and very effective treatment. Most babies will respond within a very short period of time, and they will be discharged home. But there are some babies who might need further specialist treatment, either requiring intensive phototherapy, needing more than one light, or they might need a neonatal unit, that is to be admitted on the baby unit, or they might need to have their blood exchanged in order to quickly reduce this level of the jaundice and prevent brain damage to their brain. Thankfully, this is very rare occurrence, and early recognition is key to preventing this happening and to achieving the best outcome for babies. So during treatment, babies while they're under the lights, they will be checked. Their jaundice level will be checked regularly to know when to stop the light. And for most babies, after they receive their care, they're discharged home. Very few of them will require further follow-up, depending on the course of the jaundice. And most babies will develop and thrive normally without any further intervention. Now let's talk about feeding. Feeding babies is quite a very important way of either preventing jaundice from escalating or becoming serious, or even as a form of treatment to support the phototherapy treatment for babies already receiving that treatment. So what feeding does for your baby is, as the jaundice is being broken down, your baby's kidneys, because they're well hydrated with their feeds, is able to absorb those jaundice, the bilirubin, and get them weed out through your baby's urine, and as well, baby will poo this out. But a baby that is not feeding frequently will be unable to do this effectively. So, and babies can be fed in whatever form of feeding that you as a family prefer, either breast or bottle. It doesn't make a difference. What matters is that baby's getting enough volume, is getting enough to grow, and also enough to for the bodily function to be effective to manage the jaundice. So it's important that if you are having any challenges or difficulties with feeding, especially in the first week of life, which is when feeding difficulties actually happen, either, we're still, mother and baby are still learning to get used to it, babies having challenges latching, or milk production is a challenge. Very important to reach out to your midwife, your health visitor, or sometimes there is the support of infant feeding specialists that will support you as well. So this brings me to my key take-home messages. First, jaundice is common and affects almost all newborns. And it is benign, but it should be taken seriously. Number two, it can be more challenging to see to detect with the naked eyes on a Black or brown baby because of the skin pigmentation. It is important that when there are concerns around jaundice, that we do not rely only on visual assessment, that's picking them up just by looking at the baby. It's important that babies get a TCB check, that is the skin scanner, that can be done in in your home by your midwife, or baby may need to be brought into the hospital to have this done. And in some cases, blood tests might be required to confirm diagnosis or the need for treatment. Number 3, feed your baby regularly and seek support early if there are any feeding difficulties. Number 4, know the signs that need urgent medical attention, such as poor feeding, excessive sleepiness, or difficulty waking your baby up, or your baby having dark colored urine, or your baby appearing unwell, or if you are worried. That is very important. Trust your instincts. And that is my final take-home message. Trust your instincts. You know your baby more than anybody else. If you're worried, get advice. Get your baby checked. Early assessment, early detection, and treatment can prevent a lifelong complication. If you're in doubt, get your baby checked. I want to show you a video. It just sums up everything that I have been talking about.
Hello, I am Dr.
Sorry, can you hear the video?
Helen Gbinigie.
We can hear it, but we can't see it.
Can't see it. Yeah, we can hear it.
Oh, okay. So I need to share. So I think I'll just come out of this and try to share that video. I thought it was, yeah, good. Can you see it now?
Yeah.
A consultant at Medway Hospital. I'd like to talk to you about how to recognize jaundice in black and brown babies so you can seek help early. Jaundice is the yellowing that you see on your baby's skin and the white of the eyes. It is a very common condition in newborns, especially in the first week of life. In most babies, jaundice is mild and gets better with frequent feeding and support from your healthcare professionals. However, jaundice can sometimes be serious, so it is important to get your baby checked. In black and brown babies, jaundice can be missed due to the darker skin tone, and the yellow color is not always obvious to the eyes. This video will show you how to recognize jaundice in your baby so you can get help early. When checking for jaundice in your baby, make sure you use bright, natural light, like placing your baby near a window, because artificial or dim light can hide the yellow color of jaundice. In all babies, jaundice starts on the face, including the forehead and the nose. It then spreads to the chest, the tummy, the arms, and the legs, and finally the palms of the hands and the soles of the feet. If you see jaundice on your baby's palms or the soles of their feet, it is a sign that your baby needs urgent medical attention. To check for jaundice in black and brown babies, check the white of the eyes or other areas where the skin is lighter, like the tongue, the gums, the palms of the hands, and the soles of the feet. You can also press gently on your baby's forehead, the tip of the nose, or the chest for about 2 to 3 seconds. Then lift your finger. This can make the yellow color of jaundice easier to see before the blood returns. This is called the blanch test. It is important to check your baby for jaundice regularly, especially during the first week of life. Using the parent guide to spotting jaundice in black and brown babies can help you know when to get help. Jaundice in black and brown babies can look different, ranging from a light to a darker yellow like mustard color. Look at these pictures. Can you spot the different shades of yellow? Jaundice is a common newborn condition and it is mostly mild, but jaundice can be serious. Early detection is key to preventing complications. If you're concerned that your baby is jaundice, speak to your healthcare professional without delay. Thank you for listening and see you soon.
That's it.
Thank you so much, Helen. That was amazing.
Thank you for having
Team,
me.
I can't undo my video. Can you sort that out, please?
Yeah, just 1 second.
Thank you so much. So for parents, grandparents, well, everybody has contact with newborn babies, and so this information is really vital, and that's why we're so keen to invite you, Helen. So thank you so much for coming. That was amazing.
Thank you for having me.
So we've got about 25 minutes for questions. You can pop them in the chat. You can raise your hands. For those of you that are on other social media platforms and not on the Zoom, please submit your questions and then we'll transfer them here and we'll try and get through as many of them as possible. So I think I'm going to start off with my first question, which is, how do parents, could we possibly put up the QR code? Because I think parents will be interested in having that guide for how to spot jaundice in their babies. So perhaps you can send that to the team as well. And
okay, I will do, yeah.
And distribute that QR code for everyone else after the session. We can send it out on our own social media platforms so that it can get some. It's a really useful guide. I've seen the guide, and that's useful. And I think if you can send both, the one for health professionals and also for families. So I know we all talk about parents, but I know grandparents also look after children and they're very, very involved in the first few days of life,
Yeah.
and they would welcome something like this as well. Now, another question, and I have, there's one that is jaundice, is a question here, is jaundice associated with sickle cell?
In the newborn period, I wouldn't particularly say that, but as an adult, because obviously sickle cell, knowing the pathophysiology, pardon my medical term, is that one of the issues is that you can, because of the abnormality in the red cell, it can result in cells breaking down. So I suppose as an adult, or an older child, you can have jaundice with any condition that would increase the risk of your blood cells breaking down. But particularly as a newborn, I don't think this has any play at all.
Yeah, I'd agree with that, because in general, you're born with a different kind of hemoglobin at birth, and so the symptoms of sickle cell don't always come through in those first few weeks of birth, and so the jaundice is not usually associated with sickle cell. But I think the things that I'd really like you to take home is you know your baby best. I think Dr. Helen said that numerous times, and we hear very often, I'm sure Helen's got stories herself, of families who will tell us that they were fobbed off by their health practitioners. They said, I'm a bit worried, the baby looks a bit jaundiced, but it's difficult to spot. Helen, you said one of the things that might be done is that the midwife or the healthcare practitioner that comes to the house will use a monitor, TCB monitor, but we know that's not freely available across England. So what do you advocate that if families are concerned about some of the things you've talked about and that there's jaundice, what do you think, what's some advice that you'd give them?
So advice I would give you if you are worried about jaundice in your baby, definitely to speak to your healthcare professional. If they're out of hours or not accessible, I would encourage you to bring your baby into hospital to have them checked out. There are other ways, technology is quite, is advancing, but unfortunately we don't have some of those things available on the NHS. But I am aware of other tools that are useful and family friendly that anybody could use. One of such is pictures. I could actually have added a picture of that on my slide. So they're like photo cards, and parents can download the app on their phone. So using the app and your phone as a camera, it's quite self-explanatory. It takes you through the steps that you can put the card on your baby and then scan with your phone, and it would read or estimate the level of the jaundice in your baby. And that can be communicated to your healthcare professional, which would instigate further review. But while at home, feeding is very important. Seek help. Advocate for your baby. You can ask for a second opinion if you're not happy with what the conclusion is. You can ask for further tests to be done. So if you're still concerned after an assessment, you can ask for a blood test to be done for your baby.
Okay, thank you. There's a question here that says, we keep being told that jaundice is not serious, but you've talked about it affecting the brain. And this person's put the question as why is it that we're told all the time that it's not a serious condition?
So jaundice in itself, it's not the issue. It's this jaundice happens as part of the normal adaptation that a baby will go through to adapt from being inside the womb to outside. But the main issue is if there's delay in detecting, diagnosing and treating jaundice, that is where the problem is. Because if it's picked up early and supportive care around feeding and other things required are put in place, most babies will not require further treatment. But there are very few babies that if there's a delay in picking up, then it can get to quite catastrophic level in the blood, and from there go into the brain. So even though it is benign, I will take every jaundice seriously, not as a way of panic, but to be proactive. Don't be fobbed off. And that's why we are doing the sessions. That is why we are creating the videos, the materials, the infographics. That's the guide for parents, so that knowledge will give you the confidence. You know what you're talking about. You've checked it, and you can show your midwife or anybody else, this is this guide. I have done exactly this, and this is what I saw, so that things can be taken to the next level if there's a need for that. So jaundice it's benign. It can be easily treated if treatment is required, but it can be serious. One baby developing a lifelong complication is one too many. Because it's impossible to tell just by looking at the baby that this is serious or not, then we have to take it seriously and make sure that all babies with jaundice are monitored.
Thank you. I hope that's answered that question fully. Thank you. So one of the things that you've done is you've concentrated on jaundice in Black and brown babies. Now, all babies get jaundice, but I think it'd be useful for our audience to understand why we've concentrated on jaundice in this particular group of babies.
So I think I've mentioned a lot about that. So Black and brown babies are not more at risk of developing jaundice than other babies, except they have those risk factors that I listed earlier. And by the way, those are very important information for you as a family, as a pregnant parent. Providing this, I've seen situations where a mother had a baby, and she told us in the hospital that my first baby developed jaundice within 2 hours of birth and needed treatment. So for that reason, we were quite, high on our toes with that baby. We picked up jaundice within an hour, and baby started treatment. It was a Black baby, by the way. Ordinarily, we could have picked that up much later, and it might have had dire consequences. So that is why being empowered with such information is really useful for you as a parent. If you're a blood group, if you don't know your blood group, find out from your midwife. If you're a mother who receives injections after having given birth, it means you have a rhesus negative. Your baby is more likely to have jaundice that may need treatment. So those are very important information. So bringing me back to this question. So because of the pigments in the skin tone, when light rays falls on that skin tone, the way it reflects back is different from the way a white baby would reflect, and will be easier to pick up. So because that jaundice, it's not always the yellow that we see. I mean, you can see the pictures from sometimes it could be mustard. Even in Black babies have different shades, they have different tones, and jaundice will look different on them. So that is the challenge. And from the evidence we have already, that babies who develop long-term complication, Black and brown babies are overrepresented. And this is because there was delay in recognizing and delay in starting treatment. So that made them more prone to having complications. So for that reason, we're talking about this, ensuring that healthcare professionals are receiving the right treatment, because historically the right training, more of our training has been based on Caucasian babies. So we're ensuring that healthcare professionals are skilled, empowered, confident to pick up this in babies, but knowing that we work as a unit with parents, and knowing that your baby better, you're with your baby more than we have the privilege of being. So you're in a better position to pick up those subtle signs. Sometimes it's just your gut feeling as a parent. Trust that instinct. So knowing about this gives you the confidence to say, no, I know what I'm talking about. This baby needs to be checked out.
Yeah, I always say parents who you're with your baby much more than we are. And so that gives you some confidence. And I suppose that they're just not, as you said, the training has not enabled them to recognize it quickly in this group of babies. So everything you're doing with the infographics for staff, infographics for families, all that should lead to early recognition. And if you recognize it earlier, you have earlier treatment, because as Helen says, one baby with the consequences of late treatment of jaundice is one too many. And in those babies that we have seen the outcomes are, there are too many Black babies in that group because people haven't picked it up early enough, or families have raised concerns and they haven't been listened to. And we hear that all the time. But that was the past, and we're hoping that with everything we're doing, that the future will be different. So thank you for that. Just seeing if there are any more questions in the chat. So how far have you shared your infographic, and have you evaluated the impact of families using it, and are you getting feedback from it? How easy is it to use?
I'll start with the last question. It's very easy, quite easy to use. It's in simple terms, no medical jargon, but more importantly, it was co-produced with parents, with other families. So it's a language that parents will understand. The cultural context is, what it should be. So it's quite easy to a step-by-step guide, quite straightforward. It's available on the RHO's website. So because we work together with the RHO to produce this thing, so it's easily downloadable. It can be, you can have it on your phone, even healthcare professionals, readily available, a standardized way, so that you don't even need to think about how to do it. Just look at the infographics. And apart from the RHO's website, part of our dissemination strategy, obviously, I've been to it's on this. I work in my region is Southeast England. So we have that NHS. We have it on the website there, though it's not live yet. So one of the things we've done, again, knowing that language will be a barrier, so we have this lovely infographics, and not all families have English as their first language. So we've translated this into 10 languages. And also the video you just watched is in about 6 languages at the moment. They're going to be live. Hopefully, I hope by next week, they should be ready to go. So that, again, makes it widely accessible and available to diverse families in your own, the language of your heart. So that can be, I think I've forgotten the very first question now.
Yeah, I was just going to say, though, that for those of you that don't know what RHO is the Race and Health Observatory. And just before you added that last bit, there was a question about, is it available in other languages? So you preempted.
So I've answered that question. Okay.
So it was, I think I asked how easy it was to use, and we've answered that. And the first was how far you've spread it, and you've answered.
Yeah. So it's been used. So it's been used in the RHO for the parent guide. That's the one you've just seen. The RHO sponsored for distribution across maternity and neonatal units in England. It's on Bliss Baby Charity website. So Bliss is a charity that supports neonatal unit, preterm babies and term babies who require neonatal care. It's on their website, in their shop, online shop. So you can go there and put an order, and it's free, by the way. You don't need to pay. So you put an order, how many copies, there are different sizes as well that you can order for your personal use. If you know any healthcare professional that they don't have a copy, please let them know. Go to Bliss website. The RHO is paid for that to be made readily available. Also, people have sent me pictures of it in their clinical area in different hospitals. I get emails from lots of people around the country asking if they could use the guide. So I think healthcare professionals, there's that commitment to ensuring that they have the right tools, the right skills, and the knowledge to be able to provide, the best care and improve outcomes for babies. So it's gone quite far and wide.
Thank you. And we've got some feedback here that says it's been really instructive and great explanation of jaundice as well. I suppose it's great to hear all this, and also one of the things I think we can also do is make sure that it's available on our Caribbean African Health Network website as well. So that's the way we can spread the word. Now I think the next bit, have you thought about evaluating the impact?
So I started to do that. Because I wanted to know. So one of the other things we do is we provide training for healthcare professionals. So anyone who looks after the newborn and their families in that newborn period. We provide training for them. So I have started that process to have a national review of both the training and the resources that we've created, what impact it's had, and impact in terms of healthcare professional, your confidence level, your skill, and then families, how has it supported families. I've been getting those trickles of emails of people, one of the emails I got, someone had said parents now, because it's all over the transitional care or maternity, parents are speaking up to say, I'm worried about jaundice in my baby, can you come and check them? And in some instances they've done the test and this baby's needed treatment. So every time I hear such things, I'm elated, I'm happy, because this is the reason. So because of that, we started the process to kind of do a national evaluation to know, what has it done, how has it helped, what things could we improve on, and all the like. So I'm excited to know what that result would show.
Well, thank you so much. So as let's just see, there's a long question here. An emergency C-section, there's a team of midwives who came to see me, removed their newborn without any prior warning, from a baby that had jaundice. I'm really sorry to hear your experience about that. That is really not how we would want to interact with families who have new babies at all. This sounds really horrendous. And I hope you're able to give them some feedback about your experiences and make sure that they do better in future. Both Helen and I are healthcare professionals who work on neonatal units and also across maternity services. And this is not how we would approach looking after any babies that needed additional care. So I'm really sorry to hear that. And I hope that this session has empowered you to speak up and give feedback at the time so that they can change track if they're not treating you right. So we've come to the end of the session. I just want to say thank you once again to Dr. Helen for coming and providing such a wonderful, wonderful session. We will hope to share the resources you provided on the Caribbean African Health Network site. And lastly, I just want to say, for those of you that are here or going to watch in the future, these sessions are for you. So we hope to bring you sessions that will impact on you, improve care for our community. So if there are any topics that you want us to look into or topics that you've heard before that you want to follow up on, just contact the team and let them know. It's Black doctors providing advice for our community every week. And thank you for listening.
Thank you.
Bye.
Good afternoon, everyone. As our health hour for today comes to a close, I would like to extend our deepest appreciation to our guest speaker for the day, Dr. Helen Gbinigie, for that insightful and empowering conversation around jaundice in Black and brown babies. Thank you for stressing the need for us to pick up subtle signs on our babies and for us to advocate quickly or early for us to seek early treatment. And to our incredible host for the day, Dr. Ngozi, thank you very much for guiding us through today's session and for your continued commitment in improving maternal and child healthcare outcomes. For everyone on the call, thank you so much for joining us today, taking time off your busy schedule, joining us to learn a lot about jaundice in newborn babies. Before we finally close, kindly hold on a few minutes for me as I share my screen to give updates of our upcoming programs and services that we render here in Cannes. Please give me a thumbs up if you can see my screen. Okay. Thank you so much. Health Hour returns next week.
Leona, sorry, could you make it full screen, please?
Okay. Is that okay now?
Yes, yes.
Okay. Health Hour returns next week within the same hours of between 11 a.m. to 12:15 p.m. And next week, our topic that we'll be speaking on is navigating mental health for boys. Our guest speaker will be Dr. Ayo Olatoye. So please don't be here alone. Invite a friend, invite a colleague or a family member to join us as we learn more about navigating mental health for boys. On the 20th, come join us on the 20th of June, which is on a Saturday, between the hours of 12 p.m. to 6 p.m. as we come together to celebrate the legacies left by the Windrush generation and to honor the contributions they've made in our communities. So the venue for this event will be the Alexandra Park, that's Moss Side. Expect live music, cultural performances, local stores, and free health checks. If you are interested, if you are a vendor or interested in a store, mounting a store, kindly email windrushday@can.org.uk. And on the 4th of July, 2026, in London, we have a black tie event coming up, which is the Black Healthcare Awards, where we do recognize the contributions made by our Black healthcare professionals in various sections. Please join us on this day as we partake in a 3-course dinner, live music, premium networking opportunities, and the rest. If you are interested in securing a ticket, kindly scan the QR code you are seeing on my screen or contact us on Black Healthcare Awards at can.org.uk. Do you need support with any of this? Are you struggling with unsuitable housing and want to explore some options? Are you unsure of how to apply for benefits or what you are entitled to? If all this falls within your lane, kindly email us at advocacy@can.org.uk to receive support from us. If you also live within the environs of Enfield or within the Enfield community, we have an Enfield Black Community Health Forum going on once a month. If you are interested and you want your voice to be heard in order to influence health policies and services, build valuable connections with community members and health professionals, kindly register now using enfield@can.org.uk or reaching out to us using the contacts you are seeing on my screen. Okay, with the surge in the prevalence of health conditions affecting men and women of color, CAN and APPG on Black Health has partnered in order to work closely with primary care networks to improve early detection, referral pathways, and culturally competent support for Black health, women and men through research, policy recommendations, and reforms. If you are interested in this these areas of work that we've already started with, kindly reach out to us at appg@can.org.uk. And thank you so much for joining us today. We hope to see you all next week. Bye-bye.
And that's our time for today. Whether you joined us on Zoom, Facebook, LinkedIn, or YouTube, thank you for making the Health Hour part of your Saturday. We hope today's session gave you the right dose of health wisdom that you can share with your friends and family. When we share knowledge, we strengthen our entire community. Mark your calendar. Next Saturday, same time. Got a topic in mind? We want to hear from you at health@can.org.uk. Health Hour, hosted by the Caribbean and African Health Network.